Hello, guys. Good day. This is Anna of Reinforcement Club. Today, we are going to talk about why prevention is better than cure. Yes, indeed, this is basic and it is easier said than done. Sometimes we forget about it because, you know, we are in a survival mode this time. This is such a hectic economy, and sometimes we forget about ourselves. Now, today, I am going to remind you the 7 reasons why prevention is better than cure. Why early detection improves outcomes. Now, the first reason is that preventive measures are much cost effective. It is much cheaper. Those vaccinations, screenings are generally much cost effective rather than spending on the treatment. Even you have to pay for the hospital stays and your long-term care. So early detection prevents complication and it saves money basically. And when we look after ourselves, when we take in charge of our health, we are even more productive. Not only you and me, but for a number of population. And when people are productive, it is also beneficial for the economy to the point that it can even increase the probability to boost the economy because people are happy and healthy in such a way. I know that's quite challenging, to reach that point, but we cannot take chance if we just let it pass by. The only way to participate for a better economy, better delivery of healthcare system, much efficient care is to really look after ourselves. Preventive measures. The second reason why early detection is empowerment is it because it reduces the incidence of chronic and acute diseases, leading to longer and healthier lives among people. For example, regular exercise, balanced diet, avoid smoking, or even trying to stop smoking at all cost helps people prevent many lifestyle-related diseases like heart disease, diabetes, and even cancer. Early detection also prevents complications. And when a certain disease will be detected earlier, it is much, those diseases can be much manageable and can be treated, when they are in a period where, or in the condition, or in the level wherein they still can be treated, like cancer. First stage, stage 1, stage 2, and we're fighting for that to really eradicate the cancer cells, especially stage 1, which can be detected through screening. Now, this is really good. The third reason, preventive measures reduce suffering. Think about it. When for example, when we happen to prevent a certain disease that we could have, which runs in the family, it can help individual or a person to avoid pain, disability, and complications of those severe health conditions. Like, for example, high blood pressure or diabetes runs in your family, and since you don't want to be one of them, you do your best every day to exercise, to do balanced diet, to have a blood works every year or every 6 months, so that you can track your sugar level, your cholesterol. So that is preventive measures, and that will also make you much powerful than all types of care available externally. And preventive measures has also a good impact in our mental health. It can even make us less anxious and stress associated with illness and its treatment. It's better to really detect it as early as you can, or just routinely do it to show love to yourself, to show value to yourself. And number 4, Preventive measures have public health benefits, like for vaccination. When there is a high vaccination rate in a certain community, that community can develop a herd immunity in which the diseases, like for example measles, pertussis, tuberculosis, can be eliminated or significantly reduce the prevalence when there's a lot of people complying for the early treatment. Like for example, tuberculosis. Knowing that the people knows what are the early signs and symptoms and the modes of transmissions, and when the people knows how to keep themselves healthy, then there'll be less tuberculosis in a certain area when where those people live. And another thing, pertussis. When people know, have been educated about pertussis, the modes of transmissions, ways to prevent it, including the management, and the most part, vaccination among children, it can lessen the probability of having a single person, or let's just say more people, like 20% or 30% of the population in a certain community to have pertussis, if they know how to handle it in the first place, when they have been vaccinated. And preventive measures reduce healthcare burden in a way that, like for example, COVID was a surprise, but this time we have vaccinations available. So if you're happy enough to get it, then why not? In that way, like for example, vaccinations, it reduces strain on healthcare facilities and even providers. That they don't have to work overtime. They wouldn't even experience the so-called understaffing because of the prevalence of this certain preventable disease in the area. So, when we do preventive measures, we can also avoid that situation, that incidence. And number 5, preventive measures is much sustainable in long term. Think about it. Preventive measures encourage individual to adopt healthy habits and lifestyle. And in that situation, a number of people is taking in charge of themselves, of their health. So they're doing their best to really look after themselves to maintain these good habits, which will take a lot of effort for them, but they'd be happy enough to do it. And as a result of this, when people are doing healthy habits, it is much sustainable in the long run. It even have loads of health benefits. They can even educate their best friends, their family members, to really make them a role model. So that's also a way for some sort of like a herd immunity by means of education, health education. And prevention often involves addressing environmental factors contributing to disease, such as pollution, unsafe water. Improving ecological health has lasting benefits for the entire communities. So not only to people, every individual wherein they look after themselves, but also for in the part of the healthcare system, like dengue in some parts of the Philippines. So when dengue fever disease is prevalent in a certain community, so the government will do something about it. The community health nurses will educate the people in that area, and they will also have a massive campaign in the television. Other than that, they can also delegate tasks to some community members to clean the environment, to get rid of those habitats of this infective mosquitoes, dengue mosquitoes, the carrying the chikungunya virus. Now, preventive measures has also an ethical and social considerations in a way that it can be more, this preventive measures can be equitably distributed across the population easily because it's cost effective, ensuring that all individuals have the opportunity to maintain good health, a large amount of the population. because it's cost effective. And it empowers individuals with knowledge and tools to really take control of their health. And they can't really they cannot be empowered and use any tool if it's not available. So when a communicable disease is increasingly, increased rate of pertussis in a certain area, in this way, the government, the Department of Health, will really take over by means of spreading the news about it and education about healthy behaviors, preventive measures of pertussis, so that people can able to make informed decisions and participate actively in their health care. Lastly, prevention is better than cure because it helps us avoid to even get away from multiple diseases. So now let me explain. When you exercise, do balanced diet, you look after yourself, your relationships, you can be more productive. And when you are taking good care of yourself, you do your best to control your blood pressure. You even aim to maintain a healthy weight, eat nutritious diet. Yeah, I've already mentioned balanced diet. In this way, you can prevent various health conditions, like, for example, heart diseases, diabetes, and even certain cancers. So, with just an effort to be healthy, you can prevent multiple health diseases, health conditions, which can compromise you and your family in the long run. Now, prevention is better than cure because it saves costs. It improves life quality. It reduces suffering. It even benefits the public health and supports long-term sustainability and equity for the entire population. By preventing diseases before they occur, individuals and communities can enjoy healthier lives, free from burden of preventable illnesses. So that is the reason why I need to remind you and me, that prevention is better than cure. So if you ever love this content today, you can share it to your family and friends. You can follow me in my YouTube, Facebook, Spotify, Apple Podcasts, and even Amazon Podcasts. This is Reinforce Me Club. And by the way, I do appreciate your time and have a lovely day ahead. Thank you.